Hey guys, what's going on? How is everybody? I see Roel's in here. Debbie's in Australia. We got a few people with us tonight so far. We're going to let a few more come in here. We are live over on Instagram as well. I see you, Teresa. I see you, Algie, I believe. Roger, what's up? Milling 4 family. Thank you guys for hanging out this evening with us. This is the live performance medicine show, live Q&A. Let's see, my brother Tom, what's going on? What is going on? All right, let's see where we're at. We are live everywhere. I did. I did. Thank you, Lisa. Let's see here. All right, we've got some people coming in. Thank you for sharing the podcast, the live broadcast tonight. If you this is your first time with us tonight, let us know. Let us know where you're at. Bianca, what's going on over there in Nashville? D. Lynn, hello. Great to see everybody. Let me know you're here. If you have questions, Andy's going to be with us tonight. If you have questions for Andy, go ahead and put it in the comments. Stan, what's up? Edna, what's up? Thank you, Roel. Let's see here. Frida, over there in Kingsport. Might get some snow. We'll see. All right. All right. Thank you guys for joining us. Live Q&A show, performance medicine show tonight. Thank you, D. Lynn. All right, Michelle, what's going on over there on Instagram? Thank you for being with us tonight, as always. Thank you, Katie. Hey, I don't want the snow either. Terry, what's going on? Terry, you in South Carolina today? Great to see you. All right, real quick, if you guys have not heard, this went out today. Ivermectin, Common Sense MD. Really, really important episode, fun episode. If you guys have not seen it, please go watch it, but wait until after the show. Such a it was one that Doc's been wanting to do for a long time. So really, really awesome episode. I hope you guys watch it from the beginning to the end. Happy Tuesday to you, Ivy and JC with Ivy. Yeah, Tom, that's right. 4 to 8 in the mountains. Goodness. Yeah, he did, Tom. Yes, that's right, Bianca. That is right. Go check out this video if you haven't. It's also on all the audio platforms, the Apples, the Spotifys, all of them. Check it out. And we've got a brand new Explain This episode that went up today as well. Thank you to Robin Riddle for taking the reins here with special guest Kristen Brogard from Path Fertility talking about sperm QT. This is about sperm health and the role that plays in fertility. Super important episode there from Robin. Thank you, Robin, for doing that with Kristen. Really, really amazing episode there. Let's see. I'm going to put this up here for those of you in the Tri-Cities. Breast thermography. We're doing that in our Johnson City office only March 27th and 28th. It's coming up here in the next 5 weeks or so. Definitely take advantage of that if that's something that is interesting to you. My brother Steve, what's going on? Great to see you. Anna, what's going on? Kelly with a Y, I see you. Great question there. Rachel, what's going on? So I'm assuming it's Rachel, Wesley, and Robbie. I hope everybody's there. I love it. All right. So you saw Andy today. Sweet. That's awesome, Terry. All right. Lee over there. Leah on Instagram. What's up? I believe Andy's on his way. All right. I love it, Rachel. Shout out to the fam. I could start calling you the Jackson 3. All right. Real quick before we get started with Ange, I want to say real quick, we are doing a live discount as we're starting to do. We got 40 of you guys with us tonight so far. We're doing $10 off the stress relief right here. $10 off the stress relief and $10 off the immune complex right there on our show. performancemedicine.net/shop. They'll give you the discount code right here. I had to do two different ones. The immune complex for $10 off, use the discount code immune10. And then for stress relief, $10 off, discount code is stress10. I know, not very creative. But I was trying to come up with something creative and it just did not happen. So I'll be putting that up throughout the episode. $10 off on our store of the stress relief and our immune complex. Right now I'm taking the immune complex every day instead of the super right now. Actually, let me explain why. Let me see if I can find what's in the immune here. Where is it? I believe Andy's getting ready. Where's the immune? Okay, maybe I can't find it. Oh, there we go. It has 1,000 vitamin C, 5,000 of D, has K2 in it, folate, vitamin B12, which we love, zinc, 30 milligrams, and quercetin. Quercetin's the big one there. I think it's the big difference between that and the super. So I'm taking 3 of those each day right now. I'm not taking the stress relief, but I know Amanda is, my fiance. We're about 2 weeks out from getting married. Andy, ready to roll? All right, you ready? Cool.
Hey.
Hey.
Can you hear me?
I can hear you. Can you hear yourself?
Yeah, sorry. Mom was sitting in the seat until 2 seconds ago, so I have no idea what I look like.
You look great.
I look insane.
You look great.
You know it. I look insane. My hair looks like Jimmy Neutron.
Let me take a little screenshot for you.
Your hair, on the other hand, Ben, looks amazing.
Shout out to Jonathan. Huge
shout out to Jonathan. He is our lifeline. I obviously am doing him no favors today. Sorry, I just couldn't look at myself before I became live. I actually was FaceTiming with my friends Tony and Anna today, and I was like, I look like Jimmy Neutron. Like, this is the day that I had. This is what Kingsport does to you, okay? I've been working Kingsport this past month for Dad, and this is what Kingsport does to you. It makes your hair look crazy.
Well, you know what? I have a feeling that this was.
I'm just kidding.
I think this was one of your favorite visits of the day. Terry Say saw you today. I'm sure this was one of your favorite visits. I love it. He's the best.
First off, Terry and I go way back, and I love Terry. Smart as a whip, and just a wonderful, beautiful human being. Yes, he knows his stuff.
We got Robin Riddle in the building. Robin, what's going on?
Robin,
how are we?
You had a long day, Robin. You're popping in on here. Robin and I got off the phone not too long ago about patients. So, Robin, thank you for spending your evening with me. I'm going to regale you with stories today, and I can't
wait. Doug, what's up? I see.
Oh, yes.
Doug's in the building. I see Grandma Mary's in here. Happy late birthday, Grandma Mary. I believe.
Oh, Kiki. So, yes, Kiki. So, she turned big 89 this week. We celebrated her birthday. We have a joint birthday. My birthday is Saturday. And so, Tabitha, listen, I tend to shake things up a little bit in Kingsport too. I'm a talker. So, and it never ends. So Tabitha, I appreciate all your patience today. And also too, everybody in the Kingsport Clinic who is patient with me today, Jessica, Sherry, Shelby, Courtney, Kara, everybody was so patient with me today.
I love it. I love it. Shout out to the Kingsport office. We love you guys. I see, let's see, Ben Curtis is in here. Ben, what's going on, my brother?
Also, Ben's getting married this year too.
He is. Are you joining me on the haircut train, Ben?
Yes.
Are we getting haircuts, Ben? Ben and I were rocking the long dues. Okay, we got some questions coming through here, and so we're going to get to all of them.
Wait, two before we start, can I tell you an interesting thing that happened today with patients?
What's up?
Okay, so this it's something that I think it's important to note too out there, because there's a lot of different things, and controversy is not the right word. Debate is the right word about hormone replacement therapy, especially with women, and the big cancer history and stroke and pulmonary embolism and what happened with the Women's Health Initiative. We hear this all day. And I had a patient today. It was just very interesting. She was told by her gynecologist that since she went through menopause, and granted, she's not 65, she was in her low 50s, 52, 53. She was told by her gynecologist that she couldn't see her anymore. She says, "Oh, I can't do exams on you anymore. You're in menopause." She's like, "But you're my gynecologist. Like, don't you continue doing exams?" She goes, "No, once you're in menopause, that just goes to your internal physician." I was like, what? That's not even traditional guidelines. Traditional guidelines, and they're changing these, are that you continue through age 65. And then her internal physician, she went to her internal physician and told, like, "Hey, I'm having these symptoms. I'm having hot flash and night sweats, and just curious about hormones." She's like, "Oh, no, we can't prescribe that. So I'll give you like Effexor, like an SNRI, which is serotonin and norepinephrine, which has nothing to do with your hormones. And two, off-label can help out with some temperature dysregulation." But I just find it interesting that stuff is not talked about, that's what's happening, because I've been out of it for a long time with traditional care. It's just I've got stories for days, but it's just my encouragement to everyone out there is to be your own health advocate. Be your own health advocate. If something doesn't sound right to you, and that's actually, Robin and I were talking about a patient of hers today, and it was a complex patient having a lot going on with some autoimmune type symptoms. And some of it might be related to a surgery she had. But the group that did the surgery is like, "Oh, no, that will never happen." I'm like, maybe get a second opinion. If something feels like, that's the only encouragement for you, that like, to be your own health advocate. That was my biggest thing. And she came and she's getting treatment and going to feel better. But it's just, it's interesting.
Yeah, I'm glad you mentioned that, Ange. One, if there's anyone in here live with us who have experienced something similar, let us know in the comments. I think this is a conversation we need to have more of. It's obviously something we see a lot of in the office with, and there's a lot of negativity around hormones, and I'm sure there's reason. I'm sure there's some bad actors out there. But go ahead.
Yeah. Or yes. And to go to someone who knows what they're doing.
Yes.
And to a lot of it too, it's helpful. We're lucky, that we have a lot of different providers with a lot of different backgrounds. Critical care with Bo. We're bringing someone new who we're going to introduce in a month, who has a cardiology experience and electrophysiology experience, podiatry, orthopedics, osteoporosis, surgery, urology. We've had a ton. So it helps for that. And also too, for other patients who have experiences. I always tell people for injections that you'll look like the people in the office. If you go into a place who does injections with filler, Botox, you'll look like them, because that's who they practice on. And so if you go to a place or have friends who come and see a particular clinic for hormone replacement therapy, you're going to have pretty a similar experience. It's not always the truth, but it's not everybody knows what they're doing, or everyone's too even trying to figure out what they're doing, because this stuff's not routinely taught. So I have a lot of empathy for people starting off with it, but it takes a little bit of time to get your right regimen. So I find we're very, very lucky.
Was that your message to this patient today, Ange? Was it just, hey, you need to, or was it your encouragement to her, be your own health advocate. We're proud of you for coming in here, despite maybe some, going outside the box or whatever?
I was all about it. She was just the loveliest person. We just get really nice, wonderful people. So she's such a bright spirit. I got a lot of bright people. I had a lot of fun people. I had so many fun people today. No, it's just like, I'm glad you're listening to your body. None of the stuff that she was taking was working. None of it was working. She's still symptomatic. And two, Effexor takes a while to get off. So it's going to be a journey for us to get off of that and on some other things. So it's just, yeah, absolutely. You got to be your own health advocate. If something doesn't, so, and I've even experienced that as a patient with type 1, that
Yeah,
it's like, if
yeah.
something doesn't feel right, I remember someone told me, that I had an insulin pump with a wire and I wanted an Omnipod. And so I was like, hey, like, what do you think about that? Do you think I could do it? I've heard really great things. And this provider just kind of is like, just tuck in the wires into your pants. I was like, but it gets stuck in doorways. And he's like, hey, I'll help you. Just tuck it in your pants. And the rep's not here. I don't feel like it. I was like, okay, I'm not coming back. I never went back.
Right.
It's like,
Right.
I trust my gut to say, okay. And I was lucky that I had alternatives in medicine to go for. But if something doesn't like exactly fit right to you, you can kind of get a sense for it. And then you can give people second, third chances. My big thing was that it's interesting to me that was out there, especially at not the right age. Like at 52, you usually continue to do exams. And then I'm not surprised by people not doing hormones outside of a place like an integrative health place, but it's just interesting. Wait, did you have something from Robin up here?
Yeah, let me put this back up. This seems to be a patient story. I love these. So thank you, Robin, for putting this in there. Had patients OBGYN tell her she couldn't take bioidentical progesterone that put her on because it would cause increased risk of cancer. Yeah.
And then put her on synthetic progesterone. So the risk from that, so the study that says this causes cancer is synthetic progesterone. That's odd. That's odd. That's odd. And some of it too, we can, and it's some, I don't want this to be a bashing session of traditional health. Traditional health is great. We utilize traditional health all the time. We have to refer to people, and we have amazing people in both the Tri-Cities and Knoxville communities who are fantastic medical providers. We need traditional health, but we got to work cohesively with it. So I'm never one for a blanket statements. Like, that's a blanket statement. Bioidentical progesterone causes cancer. Tell me more about that. If someone tells me that, I'm going to be like, hey, I want to know why you said, like, really? Does it? Show me where it says that, or show me in your experience where every time you give someone bioidentical progesterone, which this person's probably never prescribed, that it caused cancer. You cannot throw the baby out with the bathwater. You can't.
Agreed.
You just can't.
Agreed.
So no, I'm. It makes me very thankful. I feel very, very thankful that we get to do this, and we have people like Robin who can explain this.
Yep.
Oh, it's great. Yep. In a room. Hey, Andy, can you explain this to me? No,
but Robin already did.
No, but Robin can.
Robin can.
Video on it.
I love it. I love it. I love this from Robin here. Synthetic increases cancer risk by 20%. So this is synthetic progesterone or hormones. Thank you, Robin, for that. All right, we're going to get to some questions here. If you have a question for Andy, go ahead and put it in the comments. Anyone, if you're new, let us know. I see DPC is in here again. Thank you so much for being with us tonight. I know this is one of my favorites. Kathy, what's going on? Great to see you.
Kathy!
Thank you for being with us tonight.
Come see me.
All right, we've got a great first question here. We're getting right into it, guys. Pairs a little bit, with the last 3 weeks. We've done a little bit of a series on COVID the last couple of weeks, with today being on ivermectin. What lasting effects does the Pfizer COVID shot have on people, mental health, tremors, etc.? ? And we'll keep this, we'll keep this in general. What's your thoughts here?
This is a great question. And to maybe I think it's maybe can spark a conversation just about vaccines in general, and not like a bashing session of vaccines, but just what is the purpose of a vaccine and how does it work within the body? I'm pretty big on mechanism of action. So what are the lasting effects? So we'll talk first about the Pfizer COVID shot. So with COVID, they were coming up with vaccines, and they were coming up with them in 2 different ways. Pfizer and Moderna had one particular way to do it called mRNA technology, which is new. And J&J had a shot, and I believe it was with the DNA of the adenovirus that's supposed to spark an immune response. Most often vaccines, the way they work, like the traditional flu shot, is that they give you a deadened, weakened, or inactive version of the virus, or of whatever it is you're trying to, of the virus or the pathogen that you're trying to fight a response. So as you inject or get this weakened version of it in your body, it's almost like, this is going to be a weird analogy, but there's a wolf and the wolf's going to attack and kill you. But you find a wolf that you've beat up really, really bad and it kind of limps in, and you're like, oh, I now have the tools to attack this wolf should the wolf come back fully armed. That's kind of how a vaccine traditionally works. So flu comes in, your body knows how to respond to it because it's a weakened version. It's technically giving you flu. It's giving you and what they do is, with the flu shot, it's a little bit different because they guess about the strains, because these strains are mutating all the time. So they guess about the strains, and they kind of have, like, I don't know the exact accuracy, but maybe around 50% chance of it actually being the strain that you encounter. But and that's not how every vaccine works, but that's how some of them do. With COVID, they did mRNA. So mRNA is almost like the translation of what DNA. If DNA is the recipe book, mRNA kind of tells you how to use it. So mRNA comes in, and they're doing mRNA of COVID. So it's not giving you COVID. It's technically not giving you COVID. It's telling your cells how to fight a fragment of COVID. So it's changing how your cells respond to particular spiked proteins from COVID. So that's what the mRNA, and I'm not a vaccine expert, so please correct me if I'm wrong in the comment section. I wish we had like a fact check, but that's my understanding of how mRNA works. The hard part is that it hasn't been out that long, so we're finding out more and more about some of the lasting effects, both positive and negative, that they can have. We do know, and it is on the product insert, the patient product insert, that particularly with COVID, Pfizer COVID shots, there is an increased risk of heart damage, myocarditis and pericarditis. Myocarditis is inflammation of the heart muscles. Pericarditis is the lining of the heart. So it can make those inflame and cause damage to the heart. So that is something that actually can be a documented lasting effect that some people have had. There's also people, and I won't speak about vaccines in general, it is introducing something new to your body. It is a new trauma. It is a new stressor meant to make your body make a response. And anytime you make your body mount a response, it can have a positive or a negative response. So that's where you're seeing, like when it's mentioned about mental health, tremors, really any type of vaccine, any type of sickness, including just COVID in general, can make your body mount a response, and you can have lasting effects from it. And it's usually from the inflammation that whether a shot or an injection, a vaccine, or what the actual disease onset of COVID can cause. So mental health tremors, I can't speak to those specifically because I don't know. I have seen people come in with what they attribute to vaccine injury. And what I've seen, particularly because it speaks to me, is that I've seen onset of type 1 diabetes in patients that normally wouldn't have the onset. Patients in their 40s and 50s, they get type 1 diabetes a week after the shot, automatically into DKA. I've seen it probably 5 or 6 times. So I know that it can mount a response against the immune system. There's something called COVID long haulers, which is going to be probably the next autoimmune illness. I believe there's 105 or 106 known autoimmune diseases that have names and antibodies associated. And they believe COVID long haulers is going to be the next one that's added to it. There's even institutes that are dedicated to figuring out treatments for COVID long hauler. So too, that can be brain fog, so mental health. Tremors, I don't know about tremors specifically. I haven't seen that, but I have just seen some odd fatigue, people describing that they just don't feel right. And a lot of it is, I've seen it more within the endocrine system of it throwing off hormones, throwing off diabetes, insulin. So that's where I've seen the long-lasting effects. If you want more information for whoever wrote this question or for those who are listening, the frontline doctors have certain protocols that people will use. There's iRecover, there's iPrevent, there's another one that's specific for prevent COVID, treat COVID, help with COVID long haulers, and there's particular all natural and some prescription management that you can do for lasting effects. But I wanted to know that the reason this stuff happens, because I feel like this can get into a little bit political or nefarious thing, is that you're introducing something into the body that your body's never had before. So your body's going to mount a response. I've had plenty of friends who have had the COVID vaccine and nothing has happened. I've had a lot of people who've had the COVID vaccine, and a lot of things have happened. So that's kind of with anything in life that some people may mount a response that's a negative response, some people may not. So but the known lasting effects or increased risk can be from myocarditis, pericarditis. Brain fog is what I see most often. And then it can induce a cascade of autoimmune illness. Is that a long-winded answer? I think it's important to know, like, what is Pfizer and Moderna is mRNA, J&J is not. And the mRNA is the new technology that is out there to mount an immune response. And that's where the whole spiked protein thing comes with, because the mRNA is supposed to respond and mount this response. And that's where the spiked proteins come from.
No, I'm so glad. I'm thankful and grateful for this question. It's timely, obviously, with the last couple weeks with our content, and a great answer there. That was super thorough.
And I'm thankful for you and that haircut, Ben. I'm just thankful for you and that face. Okay, I am.
Real quick, I'm thankful. I talked to Katie before the show about offering a live discount. We're going to be trying to do this most weeks. We're doing a live discount all show and probably through the rest of the evening, and it'll turn off tomorrow. We're doing it $10 off the Immune Complex, which is this one right here, $10 off. All you got to put in the discount code is Immune10, and then the Stress Relief. All you got to put is stress 10 to get the $10 off tonight. Performancemedicine.net/shop. All right, we're going to get to the live questions. If you guys got a question for Andy, go ahead and put in the comments. I've already seen a couple great ones. Let's start with, let's see where I can find it. All right, let's start with Kelly. Kelly, thank you for being with us tonight. I'm currently taking the mini pill to help balance my hormones. After being off birth control for several years, my OB encouraged this option. It's progestin only. It has helped me feel more stable. However, the fatigue is insane, and after 8 months, I've noticed changes to my mood. Could I just switch to progesterone cream? I'm new to all this. This is not for contraceptive, just to help the crazy mood swings I had before. Kelly, thank you for this question. This is kind of goes along with what Andy was talking about in the intro there. Andy, how would you kind of respond to Kelly here?
Yeah. Can I just say that my first answer, if I was asked this in a room, would be, Robin has a video on this.
Yes. Yes.
She totally does. Thank God for Robin. Okay, so she hasn't explained this. It's a beautiful, Kelly, this is a great question. There is a beautiful video on it that Robin explains the difference between progestin, progesterone. So the mini pill is progestin, which is a synthetic progesterone. So it's a little bit different. The difference between synthetic and bioidentical means that it's the molecule of whatever it is you're taking is shaped exactly like what you're in. It's bioidentical. It's identical to what your body makes. Progestin is synthetic, meaning that they add rings and attachments to it so that it's not a natural thing, but you can market it as, I made the mini pill because I own the rights to progesterone that has this attachment group on it, which makes it progestin. So that's what the mini pill does. The idea is that it still hits the same progesterone receptor and can have same alleviation of baseline symptoms, but it doesn't quite hit it the same as progesterone does. So it feels more stable, but fatigue is insane. After about 8 months, I've noticed changes to my mood, which can happen sometimes. I would say 2, and it's after being off birth control for 7 years. So birth control too gives you a little bit of synthetic hormones too. It can be in combinations of progestin only. It can be in combinations of estrogen and progesterone, both synthetic versions of those. And what that does is it stops the LH ovulation cycle. That's what it does. And there's an LH spike, a surge that happens between days 12 and 14. And when you block that, really what it is you're supposed to have an increase of your natural estrogen up to a point within the follicular phase going into luteal phase. So as you're making these follicles, your brain's supposed to have this LH spike so that there can be ovulation conception happening in days 19 through 22, and progesterone takes over from there. When you take a birth control, it keeps everything very low, so your body doesn't recognize the spike. And then there's no LH surge, which means that you have a decreased risk for ovulation, which controls birth. Your body gets used to that, and it gets used to not sending out signals through FSH and LH from the pituitary, luteinizing hormone, and follicle-stimulating hormone to tell your body to make their own estrogen and progesterone. So when you get off of it, it can really shake you up. It can shake people up, especially if they've been on birth control for a very long time. And birth control has its place. But it depends on, Kelly, where in the cycle of life you are. If you're still having cycles, if you're still actively menstruating, how regular it is. Is it monthly? Is it changing? Are we in the perimenopausal phase? And 2, can you switch to progesterone? Absolutely. Yes, and it doesn't just have to be cream. You can do a bioidentical progesterone pill. You can do a bioidentical progesterone troche. You can do, which dissolves under your tongue, and the same thing as a trit, which is a smaller troche that dissolves under your tongue. Progesterone is one that doesn't increase coagulation factors. So if we take it orally, that's fine. It's not going to increase stroke or PE risk. Or you can just do a simple progesterone cream too. This is a no-brainer. I would switch tomorrow. And 2, it depends on the phase of life and how often you should take it. Is this a nightly pill, or is this a second half of your cycle type pill? You want to match progesterone with the phase of life. If you're in the phase of life where you're nowhere near menopause, you want to probably reserve progesterone for the second half of your cycle. Sometimes we write it for days 12 through 22, or 12 through 24, and then there's a withdrawal so you can have an active cycle. If you're coming into perimenopause where you don't really know when the next cycle is happening, you can take it continuously. And then from there on with menopause, where you're not having active bleeds, you can just take it all the time.
Kelly, I hope that helps. I'm going to put this up from Robin because Robin did do a birth control reset video. And just a little insider tip here. If you go to YouTube and you search for whatever topic, Robin Riddle, it'll come up. So birth control reset, Robin Riddle, that'll show up on YouTube for you. And there's also an Explain This playlist on the Performance Medicine YouTube channel. So I hope that helps a little bit, Kelly. If let us know if it does, if we need to clarify anything. But great question there. Okay, we're going to keep moving. I see you on Instagram. April's in here. April, I love you. So good to see you. And I see Milling 4 Family has a question. And Ange, I can't put this on the screen, so I'm just going to read it out to you. Okay. The question from Milling 4 Family on Instagram is, thoughts on onset rheumatoid arthritis 3 weeks after hysterectomy. So RA 3 weeks after hysterectomy. What's your thoughts on this one?
Can happen. Yeah, totally. Yeah, especially when you take out, it depends too, maybe like taking out, was it a total? Was it also with the ovaries? Hysterectomy, for those who do not know, is a removal of the uterus. That's called a total abdominal hysterectomy. There's also a TAH, total abdominal hysterectomy, BSO, bilateral salpingo-oophorectomy, meaning you take out everything. You're taking out ovaries, you're taking out uterus, anything that is going to make estrogen and progesterone. So going into and having an autoimmune flare after a surgery and after taking out all of your hormones, yeah, I'm not surprised by that. I would say I don't see that routinely. That's not something that normally comes in, but I'm not surprised. If your body with autoimmune illness like rheumatoid arthritis is within the rheumatological, like rheumatoid arthritis, but the rheumatological disease states are usually autoimmune, meaning that your immune system attacks certain parts of your body. Type 1 diabetes is autoimmune, Hashimoto's attacks your thyroid, rheumatoid arthritis attacks your joints. It's usually small joints, and it's usually within the synovial fluid within the joints, and they become hard and knotty. So I think absolutely, I'm not surprised by this. It's a stress, just like the vaccines we're talking about. A hysterectomy is a stressor to your system, and your system can respond that way. A lot of type 1 diabetes comes after having the flu or being sick or being stressed. Your body can just turn on and try to protect itself, and when it tries to protect itself, it can negatively affect certain systems. So not surprised by this at all. I would definitely look at low-dose naltrexone. I talk about LDN all the time. I would you can look at glucosamine chondroitin. You can look at, sometimes people will do Plaquenil or methotrexate if you kind of go the next level up with decreasing that immune response. But there's a lot of things you can do to treat rheumatoid arthritis. I would start it now. start it now, because once it starts attacking your joints, it's going to continue attacking joints. So rheumatoid arthritis usually gets worse. And so you want to stop it in its tracks once you know you have the diagnosis.
Milling for Family, does that help? Let me know in the comments over there on Instagram. Thank you, Ange, for that. I want to get to Tracy real quick on Facebook. Thank you, Tracy, for being with us.
Tracy.
Have you heard of Wharton jelly injection? If you have, do you recommend it?
Yeah. Oh, I absolutely have. So Wharton's jelly is stem cells. So yeah,
Okay.
that's what Wharton's jelly is. It's stem cells. It's not, to my understanding, like your own autologous stem cells. It's not coming from you. PRP is something that would be considered like a stem cell treatment, but it comes from you. Platelet-rich plasma just stimulates you to make some more of your own. It can stimulate hair follicles. It can stimulate joints to recreate some of the juice in the cartilage. It can help out with meniscal tears. PRP is coming from you. Wharton jelly is not. So you're taking, I believe it might be umbilical cord. I think that's, I would have to look that up, but it's mesenchymal multipotent or pluripotent stem cells, meaning that when you put that in, it can turn into a number of things to create new cells, fat cells, collagen. Did you have a question?
I'm seeing umbilical cord contains mesenchymal stem cells is what I just looked up. Okay.
Yeah. Okay. So mesenchymal stem cells from the umbilical cord. It can turn into things. I recommend it if it depends on what you're using it for. So I know an orthopedic who uses it for tendon repair. They'll use Wharton's jelly in tendons and joints. I know people who do Wharton's jelly with filler. They'll put it in their face and actually use it instead of hyaluronic acid fillers. They'll use Wharton's jelly there. I've seen it work great. I think yes, and Tracy, I would say it depends on where you're doing it, and do it from a really good, well reputable source. We don't do Wharton's jelly, and there's a little bit of legality with Wharton's jelly, to my understanding. Where to some states it might not be legal. That's kind of blurring the line with, especially with stem cells, because there's not a blanket United States statement saying you can or can't do it. So that's a little bit iffy. So I'd say depends on where you get it and depends on where you're putting it. But I have seen people recover from injury much faster with a Wharton's jelly injection in tendons and joints. And I have seen people at conferences, not anybody close to me, but people at conferences who were selling Wharton's jelly, and their faces were filled with it and they looked great.
Tracy, I hope that helps.
That's a good question.
It is a really, really good question. I hope that helps a little bit. I see my brother Brandon's in here. Brandon, what's going on?
Oh, man? Brandon. Oh, brother. God love Brandon too. Man, we had a good time. We had a time in New York together.
We had a time. Thank you, Brandon, for being with us tonight. Yeah. Let's go to, let's see, where am I at? If you guys got a question for Andy, go ahead and put it in the comments.
Ooh, I love syrup.
Love syrup. Okay, I love this from Carter. This is not the code, but yes, this is exactly what the code should be for the immune complex, or sorry, the stress code.
Carter's
That's exactly right.
Carter, I literally read that. I was like, do we have our own stress code whenever Dad's stressing us out? Is that our stress code? What is that stress code? Because give it to me, okay? Yes.
I love it. I love it. Carter, thank you for that. Next time, we're going to make that the code. Tonight, though, it is stress 10 if you want to take advantage of the $10 off the stress formula. Let's get to Max here. Max, thank you for being with us tonight, man. Do you have any knowledge about FMF, familial Mediterranean fever? What diet and medication do you recommend? I don't. I have not heard of this one.
I have not either. Familial Mediterranean fever, I have not. I feel like I've read about it somewhere. Maybe this is in school. Is it autoimmune or genetic? I would say no, I don't. And I may have to look that one up. But if it is autoimmune or genetic, then you want to do something that is going to service your immune system. Familial Mediterranean, familial, so you'd have to inherit that. It may be genetic, and may be autoimmune related. So if it's that way, I'll answer it that way. That's diet and medication for it. Low dose naltrexone and an AIP are a carnivorous diet. Anything that's going to decrease the stress and burden on a leaky gut, which usually deals with autoimmunity, would be helpful for that. I'll look that one up. So I do not know off the top of my head, but familial Mediterranean fever, that's a tough one.
I
would
we'll
say,
do, Max, what we'll do is we'll write this down and we'll do a little research and we'll come back to it. Is that cool, Ange?
and also too, maybe do like a little podcast on that, because that would be interesting, because I want to know too how common that is. Like, is that a rare genetic disorder? My guess is that is a genetic disorder that might turn into autoimmune type symptoms, and cyclical maybe it's cyclical fevers, and you'd want to do something that's calming to your gut. The calming to your gut is going to be an AIP or an autoimmune plan, like a Dr. Gundry protocol, and medication to maybe even looking at low-dose naltrexone and BPC 157 to start calming some of the immunity in your gut. That's how I'd approach it. If I did not know anything about it, that's what I'd approach. But Ben, we'll write that down and maybe throw that on for later.
All righty. Thank you, Max, for that question. We got that written down. Thank you, guys. Doug Lee. Doug, what's going on, man? It's great to see you in here. I did a GI map on Friday, not realizing it would not deliver until Tuesday, President's Day. Will this negatively affect the results? And what's your thoughts on this one?
I think you're fine. And actually, too, if Robin's still on here, she's our GI map expert, so maybe she can comment on this one, too. I think it's fine, too, as long as it's not just sitting out. It would not deliver. If you sent it off, I think you're fine. If they took it to, I do not believe it needs to be overnighted. And two, if Robin can comment on that, that'd be awesome. I think you're fine. I don't think it'll negatively affect the results. And two, if Robin says otherwise, we will post it otherwise. So GI map, for those who do not know, a GI map is gut testing. Gut testing does it tests for your microbiome with a stool test. So it's sitting off a good. GI map should be good. So I believe too, if it's just sitting around for maybe a week and sitting at your house, but if it's on transit, I think it's fine. And a lot of it is that solution that it goes in. So there's a solution that you mix the stool with so that it can precipitate and allow you to see what the microbiome looks like and opportunistic pathogens. So that's good.
Thank you, Doug, for that question. Thank you, Katie, for helping us out there. Let's get to Loretta on Facebook. Do you have anyone that deals with lung issues such as eosinophilic asthma? What's your thoughts on this, Ange?
So some people do. So there's something called eosinophilic esophagitis. So that usually means that you've got an allergic inflammatory response within your esophagus. So that's a diagnosis that's there quite a bit. It's usually a GI thing people do. Eosinophilic asthma too is going to be relatable to eosinophilic esophagitis. So really you want to decrease the histaminic response and whatever allergies are going to expose you to trigger an asthma response. So yeah, we do. I would say too, it depends on the severity of the asthma. Sometimes for asthma, it's really nice to have a pulmonary function test. And we don't have a PFT. PFTs have to come through pulmonologists. So maybe if this person that is wanting to come see us for eosinophilic asthma is looking for alternatives to say, how do I decrease the response within my immune system? I keep talking about low-dose naltrexone, but it's like, golly, it's a winner. It's a total winner. So I think you use LDN for this. I think too, you can do some antihistamines. You can work there's slippery elm. There is the syrup lady with elderberry and sumac berry that might decrease some of the allergic response because eosinophil is allergies. So allergies are inducing asthma. So we want to decrease allergies that are going to induce the asthma. And then two, we'd be able to have rescue inhalers. So that's something we could take care of, but it depends on the severity. If it's new onset, I'd say definitely go to a pulmonologist and get a pulmonary function test. Pulmonary function tests are going to tell you how quickly in and out you can breathe and what your lung capacity is.
It's a great question. Thank you so much for that question over there on Facebook. Let's see. I just missed it there. Thank you, Loretta. Let's
Yeah.
go over to YouTube. Roel's been patient with me. Thank you. Andy, my wife.
Roel.
Andy, my wife recently noticed some swelling under her eyes. Is this normal or something she should look into? She's 53 years young. She's pretty healthy and very active. What's your thoughts on this?
It depends on how long it's been there. It can totally be a normal thing, especially when the weather is 70 and then the weather is 10. So whenever you have these changes, a lot of dealing with sinuses, that's part of your maxillary sinuses. So you can have swelling under your eyes. It depends on if it's fluid or if it's hard. Hard swelling with pain, go see somebody with that. You might want to get it CT'd. If she's had injury to the area, you might want to get it CT'd. Changes in vision, you'd probably want to see an ENT, ear, nose, and throat would help. You can also see like an ophthalmologist, someone to do a fundoscopic exam. But here, I'd probably say ENT first if you're going to a specialist, only if it's not reducible by over-the-counter measures. So swelling under the eyes, usually some sort of edematous fluid state. I would want to say, check and see what environmental exposure she's having. See if it's fluid filled. It's probably just sinuses. That's what it sounds like. And you can easily do stuff at the home for that. And if you haven't tried home remedies, the things I just said for eosinophilic asthma are good things to do. And then even just looking at like nasal lavages, some rinses. Yeah, and seeing what environmental exposure she's having. See if there's been any change in laundry detergent, what you're bathing with, but some swelling underneath the eye I'm not super concerned about unless it's painful and it's changing your vision and it's hard and knotty. Not if it's fluid like, I think she's fine. 53 years young, of course. I love that. 53 years is young.
Thank you, Roel, for that. Let us know next week how she's doing. Bianca over on Facebook, please talk about infrared sauna and red light therapy for a second. I really have thought about getting a sauna or panel, but can't stop thinking, what if they determine in 20 years those rays were not good for us? I'm with you. Just hard to understand how they are not damaging like UVA, UVB rays. Bianca, this is such a great question.
This is a good one. We had one like this maybe 3 or 4 months ago. I don't know if we save responses to the live Q&A, but there's a response. I remember getting asked this. Infrared red light therapy hits a different part of your cell and energizes it. So UVA, UVB, those penetrate in different layers within the dermis. And those usually can penetrate the melanocytes to come up and to create melanomas. Those tend to be more wrinkling than red light. Red light is supposed to stimulate a particular part of the dermis, and I forget the exact layer, and it deals with wavelengths, which is why it's infrared, because the red part is a particular wavelength and frequency that's going to be beneficial to get into the dermis where it needs to go and excite the cells. And as you excite the cells there, they're going to create more cells that are going to be able to have healing properties to it. That's how I understand infrared and red light. I don't see it having that rays. I don't see it. Though it's not, I will just say, Bianca, it's not impossible. It's not impossible that it's not been a routine therapy for a very long time. But from what I've seen for it healing, especially too with like joints, like mom puts her hand in the Avicen machine, like her hand can move after going through infrared. So I think there's a lot of pretty instant benefits that come from it that I don't foresee it being a negative thing. But I would too, if you're gonna go into infrared and to red light, I think methylene blue is something absolutely to use with it, because those can stimulate methylene blue to work a little bit better. And we're trying to penetrate into the cell. And methylene blue goes into the cell and makes the electron transport chain become unplugged. And then and red light therapy makes that even more activated in it. So I think you'd be absolutely fine. And two, if there's a way to pull up, I went into a little bit of a deep dive about the particular wavelengths and how it's different between UVA, UVB, because there's differences between blue light therapy, red light therapy, the infrared, the heat that's associated with it. But I don't think in 20 years it's going to be bad.
Andrew, was that on one of the Q&As? Because I can go back. Bianca, I'll search for that and I'll clip it for you. Remind me, send me an email and let me know I need to do this, because I can definitely find that moment. Thank you for that question. Myra, it's so good to see you. Thank you for being with us this evening. Myra is asking, have any thoughts or know about a hyperbaric changer for healing tissue? Great question. What's your thoughts on hyperbaric chambers?
Oh, yeah. Hyperbaric chambers is amazing. Do it. Absolutely. Yep. It can improve wound healing. And two, I believe it's because with 100% oxygen, which is what you can get in hyperbaric chambers, it can deliver blood. It gets diffused so well into the blood that the healing time is just instantaneous. It can go very quickly. So two, you're not allowing that wound to hang around a lot. That's usually what you use hyperbaric oxygen chambers for. Some people use it for aging, because we're driving oxygen into the cell at a higher pressure. So that's the idea, is driving oxygen into the cell in with the red blood cell at higher pressure is going to speed up healing and improve healing faster. So I think it's totally worth it. It depends on what you're using it for, and it's going to get very expensive, and you'll have to seek out a place to do hyperbaric oxygen if you're doing it for anti-aging. I don't know of a place that does that quite yet, and it depends too on the type of machine that they use. There's some that are just zip ups. They look like little tent canopies, and then there are some that are hard case, and this can get to different pressures. I've been in them. Your ears will pop. It's different, but with anti-aging you have to do it regularly. With wound healing, you'll have a specific amount of time. I think it can last up to months, where you'll get into it. And I know people too will do that during cancer treatments as well. Oxygen's good for your body, and getting it delivered at that type of pressure at 100% is just going to make the body heal faster. So yeah, I think that's good.
Thank you, Myra, for that question. Let's get to Teresa here. My dad has been a really bad type 1 diabetic for years. What are some vitamins or things you would recommend that most diabetics should take? What's your thoughts on this for Teresa?
Yeah, I'm sorry. Yeah, with type 1 diabetes, it gets old. It gets old. I've had it for 20 years. Our sister has had it for almost 30. Maybe I've had it for 22 years. No, I think I'm right on 20, and I think she's 28 years. So it gets old. So sometimes it's just like, oh, you get through this burnout and fatigue. Vitamins, so usually I'm big on any vitamin for other people is also good for patients with type 1. So I think omegas and vitamin D are probably going to be your two best ones. I would venture to say too, if there's the really bad type 1 diabetes, getting him into a routine of vitamins might be a little bit difficult. So I would say making a routine easy for him and choosing the best of the best. A really high dose potent omega-3 and vitamin D is going to stimulate immune system and really help protect his brain. That's what omega-3s have, DHA and EPA, which your brain tissue has. So I'd say replenishing those, because those can get replenished. The big thing with type 1 diabetes is you want to protect the kidneys. The kidneys can go, really you're thinking of macro and microvascular complications. With microvascular complications, you're thinking of your eyes. So a good thing for your eyes is omega green tea extract. And that has helped our sister decrease her cotton wool spots or retinopathy. Then you're looking at your kidneys. So good things for kidneys are going to be water. Water can decrease your blood sugar. And two, that's a simple thing to say, increase your hydration. They say take over 64 ounces, get up to 120. It's technically supposed to be half your body weight in water. So really increasing the hydration. And then nephropathy, neuropathy, it's going to be your feet and your vascular system. So supporting the vasculature, I think, is very important too. So people will get on an aspirin to thin out the blood. Sometimes you can actually get on tadalafil or L-arginine or L-citrulline. L-arginine, beetroot, and tadalafil help out with not stiffening your arteries. It kind of relaxes your arteries and it's able to deliver blood flow a little bit better. So I would look at mega green tea extract, hydration, and then with your feet, I would look at L-arginine if you're looking at vitamins. But if anything, vitamin D and omega-3s. Specific diabetes ones are going to be, you'll look them up, and it's going to be decreasing inflammation with curcumin or turmeric, and sometimes even too doing cinnamon. Cinnamon is one. Berberrine's another one, because you can use those for type 1 diabetes because they'll sensitize your insulin. So if you look at them, those are going to be the ones that are diabetes specific. There's one called Sensulin and Berberine. If it were me, I'd make sure it's high doses of vitamin D and omegas. Then I would look at mega green tea extract with a lot of fluids. That's a good question. I'm sorry he's dealing with that. Find something that works with his routine. And what's going to be better than vitamins is the bad part of the type 1 diabetes, whatever that is, like getting him to get excited about taking insulin again is going to be more helpful for him than the vitamins. And that's a tough one. That's a tough conversation. But any treatment for type 1 diabetes or type 2 diabetes, usually the number one thing is sugar control. So however you're going to control the sugar. And if he's type 1, he's insulin dependent.
Teresa, thank you for asking that on behalf of your dad. I hope that helps a little bit. And great answer there. Kelly with an I, we answered this at the beginning of the show. If you scroll back, it's around minute 10 or so. We talked a lot about that. So once we're done, go back and watch that part of the episode. But we got to that earlier.
And Kelly with an I. We love that spelling. That's our sister's spelling.
I love it. Megan is asking, what dose should a cancer patient start out with for ivermectin? What are you and Doc talking about with this one?
So that's an interesting one. There's a great article, and it's actually another nurse practitioner that sent it to me. I believe the dosing, and I can be wrong, and it's going to be high, is 1 milligram per kilogram. Like, that's high. So whenever we treat COVID with ivermectin, or do prophylaxis, it's anywhere from 0.2 milligrams to 0.6 milligrams per kilogram. But I believe the dosing for ivermectin is daily 1 milligram per kilogram. So it ends up being quite a bit of ivermectin. And two, there's ways to do it continuously, prophylactically, and preventatively. So I would say look at doing 1 milligram per kilogram. And it depends on the type of cancer and how you can measure treatments. So where it is, do we need to look at blood markers or do we need to look at imaging? And then two, look at fembendazole too. Fembendazole is a little bit more standard dosing. I believe it's 222 milligrams and it's dosed frequently throughout the day. The idea is that we're deworming. The dewormers, for some reason, do not allow those tumor cells to replicate and can actually attack and cause apoptosis within the tumor cells. So that's the idea behind ivermectin, femben for cancer use. But I believe the dose is 1 milligram per kilogram, and there's a great study about it. It's like 20 pages, and it's definitely available online on how people do that. Other things to consider too for a cancer with patient or a patient with cancer. So look at vitamin C IVs, anywhere from 25 grams to 100 grams of vitamin C intravenously with a negative G6PD testing to look at artemisinin and mistletoe. Artemisinin is contraindicated for those who are doing radiation and doing a ketogenic non-sugar. Cancer loves sugar. So just anything that's going to be non-sugar. And most of these alternative protocols are going to be recommended to do it with CBD. And I don't know the mechanism of why. We have a particular cancer protocol at the office that kind of explains how these different mechanisms work for cancer. So if this particular patient's interested, have them come do a visit with us.
And Megan, if you want, you can email me. I can send you. We have some literature on the protocols for femben. Ben at performancemedicine.net. Let's get to Sherry real quick. What are your thoughts on GHKCU? I'm taking this with BPC 157 and TB 500 injection form. What's your thoughts here?
So GHK copper, how I know this peptide is actually not through injectable, I notice it for the face. So GHK copper, they call it liquid Botox. I went to a conference on it when I was at A4M, and they're putting it topically to help out with wrinkles. So that's how I know, and for wound healing. So BPC 157 is also work for wound healing. GHK copper is also for wound healing. I'm just a little bit more familiar with how it's done topically and not intramuscularly or subcutaneously. So I think, though, It's a yes. Sherry, it's an absolute yes. BPC injectable, TB500, all of these are for regeneration of cells, wound healing. And I'm just now finishing a BPC TB500 and loved it. Absolutely loved it. I was having muscle spasms in my back from a show I was doing a somersault in. I felt like a child. I was like, I used to kind of tumble a little bit, and I used to be able to do like round back handsprings, and I do one baby backward somersault, and it's like I broke my back. And so I was doing injectable BPC 157, which is body protective compound. TB, I believe, is thymosin beta 500, and GHK CU is GHK copper. So this is no brainer. I think that's a no brainer. Your response to treatment, though, and I would say your litmus test is your wound getting better? Is whatever aches and pains you're having getting better? It used to be that we told people to inject near the site of injury. You can really inject subcutaneously, and it's going to be fine.
I love that, Sherry. Thank you so much for that question. And this is, I love Tom. Tom, this is the best. Get a reverse hyper, man.
Okay, done. Tom, you get a reverse hyper, okay? No, I'm just kidding. I absolutely do. Tom, I love all your emails too. It's so nice to hear from you. It really is. He always has the best recommendations.
I love it. Thank you, Tom. We love you, brother. This is super timely from Mark here. FDA announced Wednesday has decided to revoke Red 3's authorization to be added to foods. Do you think we should discard products that have Red 3? So this is in regards to the dye.
Yeah. I do. And two, Mark, I would say too, this is a twofold answer. One, yeah, if you can, I wouldn't go overboard. But that's also my personality with it. I think whatever your personality with it, if it's like, I'm only going to think about the Red 3 that I'm putting into my body, then throw it away. It's only going to be on your mind, and people are going to hyper focus on it. If it's more of like I'm just going to stop buying products with Red 3 in it and kind of gently get my way out of Red 3. Red 3 has been around for like it's been in our products and in our bodies for a long time. So I don't think it needs to be a drastic cutoff, but I do think not taking it, overtaking it is a good idea. So two, I think if you discard products with it, great. If you don't, I think work your way out of it, if that makes sense. I don't think any of those preservatives are good. We went to a comedy show in New York, and that guy talked about like, he's like, if someone like injected my knee, it'd be full of gusher juice. He was like, I don't know what I was eating in the 90s. Neither did you, Ben. Neither did I. We were full of gushers and fruit roll-ups. I've had so much Red 3, I might as well be Red 3. So,
I haven't heard the word roll-up in a while.
Fruit roll-ups, gushers.
That was lunch every day.
Dunkaroos? We ate garbage. Dude, we did. It's like, we're lucky to be alive. So do all of that to say, it's like, I do think that is a good idea to get rid of those products. I do think it can get a little bit overloaded on the other way, is that on the other realm of it is that it can almost be like a little bit hypervigilant. It's like everything's going to have some sort of toxicity to it. So I wouldn't just beat yourself up over it, because it's going to be hard for people to be completely clean in the world and environment we've created right now. So
Mark, thank you for that question there. Ange, I love that answer. I'm going to put this up. Well, actually, I can't. I want to read it for Milling for Family on Instagram. Real quick, Ange, thoughts on methotrexate for RA? 38, struggling with the thought of being on this the rest of my life. Any thoughts on this for Milling for Family? 38, thoughts on methotrexate for RA? It seems like she would have to stay on that for a long time if she went on it. What's your thoughts on here?
So methotrexate is a DMARD. So that's the class of drugs that kills DNA. So it kills DNA, but it can also kill your good DNA. So that's the only thing I don't like about methotrexate, is that you do have to get testing for it first, because it can increase your risk of infection. It lowers your white count. It kind of decreases all of a hyperactive immune system. I've seen it work well for one patient. One of my patients she went to a rheumatologist and got on methotrexate, and She can use her hands again. So for
Hmm.
some people, it does work well. For a lot of other people, it makes them feel awful. Fatigue, pain's a little bit worse, and they have negative reactions to it. You have to get testing to make sure that your liver function is good because then it can affect liver function. And then two, it can make you, I think you have to get a TB test, like a negative TB test before doing it. That also might be for the biologics too. But with that, it's technically methotrexate's also like in pills that like in an abortion pill. Just to throw that out there, it can kill the DNA of cells. So that's also what it's used for. Not to say that it doesn't have its place and time, but just know that when you're taking on to that, that's also what you're taking on to, is that it's killing the DNA. I've seen it work really great, but I would encourage you to probably look at low dose naltrexone first. It has way less side effects. If you miss a dose, it doesn't matter. It's kind of like an ace in the hole that you can try out before going on that. I'd try everything else before doing it.
And
But if you have to, yes, you want to save your joints. You want to save your joints. So I don't think that's a bad idea. If you have to go on it, I would just exhaust my resources first.
if you want to, Millions for Family, if you want to learn more about LDN, we've got a couple videos on our YouTube channel. Low dose naltrexone performance medicine should show up. Montana's in here. Montana, thank you so much.
Montana,
we love you.
Montana, remember me? I used to work in Knoxville. Come on. What?
I want to put this up for, let's see if I missed it. Don, I believe Carter put in a link that she's using for Red Light. We don't sell it in office, but I know we have recommendations for Red Light Match. So thank you, Carter, for helping her out with that. And I'm going to put this up real quick. It might be the most important question of the night. When can I get Botox?
When baby Wesley tells you can. Okay, when baby Wesley tells you can. We got to see baby Wesley in the office today, and he's so cute. How many weeks is he? Like 2 weeks, 3 weeks? Put it in the comments.
Put in the comments.
He's the cutest and sweetest little boy, and Rachel and Robbie are just the best parents. It's so much fun to see them. So two, once you're done breastfeeding, there's controversy about whether it actually does anything and can actually pass through the breast milk. But with it being toxin, you kind of want to like hold on that. So that's what I think.
Let's see. He's be a month on the 21st. There we go.
Coming in on me 3 weeks.
Anna, we love you.
Anna,
Anna.
Oh, sweet Anna, my sis. She's picking up a new baby. She's picking up a new puppy soon.
Rock on. Guys, that's going to do it for the question part. I want to put this up, and if you agree with Roel, will you put in the comments?
You're too good to me, okay? You are too good.
If you believe this is the best live podcast on the internet, let us know. I believe it is. I know Andy thinks it is.
At least be entertaining.
We're top 2. We're top 2 or 3.
We're trying to be entertaining. So
I love
we
it.
are doing it.
Guys, let us know how we did in the comments. We appreciate y'all so much. So many of our team was in here. Carter, Katie, I saw Ivy, I saw Tabitha, Montana, Robin, April was in here. Guys, Ben C., we love y'all so much. Thank you for being with us tonight, each and every Tuesday. Y'all are the best. Tom, thank you for the 10. We will be back next week. Real quick, for those, if you want to do $10 off of the immune formula, immune complex, and the stress relief, is $10 off tonight and tonight only. As for you guys who are with us live, Immune 10 is for the immune complex, and Stress 10 is for the stress relief. performancemedicine.net/shop. $10 off will be going on the rest of the evening, and I will deactivate it in the morning. Thank you, guys. Thank you, Michelle. Thank you, my brother, Matt. Thank you. Leslie, what's up? Thank you. We love y'all. Ange, thanks so much, man. You did awesome.
Thank you, Ben, and thank you. Ben, thank you for being here, okay? You're here every week. You got all that energy. God, it's good.
Andy's got a birthday coming up on the 22nd. We're going to be celebrating all week long. Happy early birthday to you, Ange. Cherry, I'm going to get to that questions first thing next week. I've got it written down. I got the team working on it. We're going to get to that question first. So be here at the beginning. We will get the gallbladder question. We appreciate you being here. Ange, let's call it an evening, man.
Let's call it an evening, dude. Brad, take us out.
Brad, where we at? Thank you, DPC. Thank you, Sherry. Thank you, Ivy and JC with Ivy. Brad, take it away. Take it away. Where is it? Where's my outro? Come on, team, give me my outro.
Don't go away.